Hello, this is an instructional video on how to properly take care of your drain and record the drain outputs. During some procedures, the patient will leave home with a drain to remove any fluid that may collect under the skin. This drain has a bulb which collects the fluid and the actual drain attachment which goes into the patient's body and continues under the skin to help remove any fluid. These two components should not be disconnected at any time during the post-operative period. When the drain is inside the patient's body, when they leave from surgery, you'll see that there are dressings that protect the drain where it enters the body. Try not to disturb those dressings. If those dressings become unglued or come off for any reason, try to retape those down or call the nurses for assistance. Otherwise, when we talk about stripping the drain, what we mean, as you see in the video, is to remove any type of fluid or blood products that have collected in the drain that may cause stoppage in the drain tube. What we do with those is, holding one finger near the patient's body, you'll milk with the other hand, squeezing the fingers together, pinching the tube, and pulling back. When you let go of the pressure of the tube, you'll move those fingers to the next location and pull again. As you continue to do that, you'll be clearing out any fluid from the tube as you see demonstrated in the video. You'll do that all the way down until you get to the hub of the drain bulb, in which case any type of material, proteinaceous material, blood, products, or fluid will be in the bulb and the tube will be clear. The important part of the milking process is to hold the one fingers closed so that the tube doesn't get pulled out from the body. So by holding that close, you'll be able to milk the fluid and changing the finger location so you're never putting pressure on the place where the drain tube exits the body. When you're ready to empty the drain tube, you'll take the plug off the drain tube, which will allow this to expand again, and you'll be able to see the fluid in the drain tube. Don't use the graduations on the bulb to measure, as these are inaccurate below 25 cc's. You'll take the sterile collection container and you'll pour the fluid into that by squeezing the bulb and allowing the fluid to go into the collection container. Then you can use that collection container to accurately measure how much fluid comes out. When you're done with that procedure, the bulb will have nothing in it and it will be filled with air. You'll depress the bulb completely and replace the little stopper into the drain tube so that no more air can come into it. Then when you release the bulb, you should see that it stays nice and flat, that there's negative pressure as the drain starts to fill up again, sucking more fluid back. When you have your graduated cylinder full of fluid, once you measure that, we want you to record that each time you empty the drain. Ideally, every 24 hours you want to add that up, so choose a time that's easy for you. For most of our physicians, once the drain output is less than 25 cc's in 2 consecutive day period, the drain is ready to come out. At that point, if you haven't been seen yet, you'll call your nurse to tell her that your drain output is less than 25 cc's in 2 consecutive days. All these procedures should be done with your hands cleaned and washed. It does not have to be sterile and you don't have to have gloves on. So again, this has been an instructional video for taking care of your drain, stripping your drain, and recording your drain output after certain procedures at Ponte Vedra plastic surgery.